There is a huge standoff happening between the Indian government and the World Health Organization. India has flatly opposed the WHO's estimates over how many people died in India because of the COVID-19 pandemic. According to the WHO, 47 lakh people died between January 2020 and December 2021 as a result of the COVID-19 pandemic, the highest for any country in the world. Officially, India's COVID-19 death toll for the same period is just 4.8 lakh. This means that the WHO's estimates is nearly 10 times the government's figure. But the problem isn't WHO's mortality estimates. It's really India's system of recording deaths. Let me explain. Let me first quickly break down WHO's mortality numbers. According to the WHO, India saw 8.3 lakh excess deaths in 2020. In 2021, the WHO says that India witnessed 39 lakh excess deaths. And out of this, 23 lakh deaths took place during India's deadly second wave between April and May of 2021. So what is excess deaths? In simple terms, it is the difference between the number of deaths that occurred in a specific time period and the expected number of deaths in the same period. It includes deaths directly due to COVID-19 and indirectly because of the pandemic, such as people not being able to access treatment because hospitals were overburdened. India recently released data from its civil registration system. This shows registered deaths. India says that in 2020, 81.2 lakh deaths were registered. And so the excess deaths compared to the previous year was only around 4.8 lakh. So what is India's problem with the WHO's findings? The Modi government has broadly two objections. One, the WHO ignored India's authentic data published in its civil registration system. The government says that the registration of births and deaths in India is extremely robust. 2. The Indian government says that the WHO used a mathematical model to project excess deaths instead of using actual data. The government also questioned the WHO's methodology of data collection. I'll tell you why these arguments are weak. First, the civil registration system captures only registered deaths, not how many deaths actually took place. Not everyone in India registers deaths, and the deaths of women tend to be registered less than that of men. Even prior to the pandemic, the registration of deaths was far from perfect. In 2019, the level of registration was just 92%. Populous states like Bihar saw 52% registration of deaths, while Uttar Pradesh was just over 63%. But the 2020 CRS report fails to mention the level of registration altogether. In fact, the same CRS report admits that in Telangana, COVID-19 is one of the major causes for the undercounting of deaths. Now, while the CRS report fails to make public the level of registration, the National Family Health Survey 5 did. It found that 71% of deaths were registered with civic authorities for the years 2019-2021. Second, the CRS data that was recently published was only for the year 2020. The data for 2021 is yet to be made public by the Government of India. Third, contrary to the government's claims, the WHO did not ignore CRS data. In fact, the WHO used CRS data for 17 states. But more on this in just a bit. Now about India's objections to WHO's mathematical model. Here's why the government's reasoning isn't really sound. First, the WHO and several other researchers use a mathematical model because official data is missing. I spoke with Ashish Gupta, a demographer and a David E. Bell Fellow at the Harvard Center for Population and Development Studies, who countered the government's objections. He said that it is not true that the data is just modeled. He said that it uses data from the civil registration system, accessed by several journalists, including the News Minute. Now, data for some states wasn't available, which is why extrapolation within India was necessary. Ashish also said that yes, there are some uncertainties, but this is something that the WHO itself acknowledges. Rejecting the whole exercise for a few uncertainties is problematic. Second, data journalist and author Rukmini S. told me that WHO's methodology isn't really unusual, and some amount of extrapolation is done for countries where data is patchy, like in the case of India. This extrapolation is done based on prior understanding of mortality and demographics in India. Incidentally, this method has also been used by the Indian government in the past. Third, the WHO's death toll of 47 lakh for India is hardly an outlier. Several other papers have also estimated India's death toll to be between 27 lakh and 63 lakh during the first and second wave. Some of these have even used CRS data. Several of these have been peer-reviewed, including one published in The Lancet, which estimated that over 40 lakh people died in India due to COVID-19 in 2020 and 2021. Of course, the BJP government's response to these papers has been to reject them all. So let's face it, the problem isn't WHO's methodology or its modeling. The real problem is India's system of recording deaths. I'll give you a couple more reasons for this. Only 22% of deaths in India are medically certified. That is, a cause of death is established by a doctor. During the pandemic, several COVID deaths were not reported as COVID, simply because the patient tested negative for the coronavirus just before death. According to the CRS report, just 28% of Indians died in a hospital or a clinic in 2020. The vast majority of Indians die at home. This, together with the fact that medical certification is woefully low, means that a number of COVID deaths may not have been reported in India. What India urgently needs to do is fix how it records deaths, because understanding just how many Indians died during the pandemic isn't about record keeping or even about bashing India in the global arena. It's about improving our healthcare system and preparing for the future. Ultimately, it's about helping the government make better decisions, which lead to better outcomes. The News Minute has launched the News Minute Malayalam and the News Minute Tamil on YouTube. Go and check it out and subscribe to these channels. Remember, for us to continue doing shows like this and bring you content across our YouTube platforms, we need your support. So if you haven't already, do become a member of the News Minute. The link is in the description. And as always, if you've liked this video, don't forget to hit the like button and share this video with your friends.